Jacqui Booth. I'm the EPR lead for health records and outpatient reception. Today I'm going to undertake a demonstration of the outpatient receptionist functionality within the Cerner ePR.
As you can see on screen, we're looking at what we call the revenue cycle. And within the revenue cycle are certain applications. One of the applications being the patient tracking board. So this is a little bit like what we use currently in PAS within CMG, which displays all the patients that are due to attend clinic for a certain location. So we'll just explain a little bit about the tracking. First of all, you've got the date, which is today's date. Using the little arrow, you can look at previous dates or dates in the future. So, for instance, you could look at patients due to attend on the 2nd of June. You can also look at patients that have attended previously. So, for instance, if we look at yesterday, we had a few patients that were due to be seen or were seen in clinic yesterday. You can also use the arrows to the left to look at the previous day or to look at future dates. The next section of the screen here is basically how you want to display your patient tracking board. So, for instance, you can actually schedule the full day, or you can schedule, for instance, the next 2 hours, just to show the patients that are due in the next 2 hours or within the next 4 hours. This is useful, for instance, if you've got a really busy clinic and you've lots of patients that are due to be seen, and then you can just basically break your screen down into bite-sized chunks. And then you've got the location that the clinic's being held. You can also do a quick search, so perhaps if you've got quite a lot of patients all attending at similar times, you can actually do a quick search on a patient and bring up their details straight away rather than scrolling through your whole list. There's also another search here at the top left-hand side, and again, this might be useful if, for instance, a patient presents at reception and they've presented at the wrong reception desk. You can just do a quick search, find out where the patient needs to be, because it will display all their appointments, etc. And you can just direct the patient to the correct location. As you will see, down the left-hand side, we've got all the appointment types and the status of the appointment, and I'll explain about that as we're going through. We've got the patient's MRN number, so this is the main hospital number in Cerner, which is currently now the RXR number. Then you've got the patient's name. You've got the appointment type, so for this on this tracking board, we can see new patients, follow-ups, etc. And we've got the duration of the patient's appointments. If, for instance, it was a derm new telephone appointment, it would actually state that in the appointment type here. You've also got the resource, which is the clinician, and again, you've got the location of where the patient's been seen. So any patients that are listed as confirmed basically means that their appointment has been booked on the system. So once it is confirmed and the patient does present at reception, you actually do need to change that and check the patient in. So as you can see, this patient is in a confirmed state. So if we click on confirmed, we can change that by selecting check in from the drop-down box. So once you check the patient in, you'll get the check-in date and time. So again, as you can see, we've got a red circle here with a tick, which indicates that the patient is on time or early. If the patient does arrive late, this would be a red circle with a cross in the centre, and it would say arrived late. And then in those circumstances, if they are rather late, you would need to check with the clinician that they're still okay to see the patient, because this could just severely affect the running of the clinic. And if they are, then you just proceed as you would do normally. So what we want to do, we want to check the patient in, but also check their demographic details, etc. So we just click on OK and modify. And then which takes you to another screen to check all the details. As you can see, some fields have got an asterisk, so anything with an asterisk you do have to complete. These are mandatory fields. So we need to select the hospital facility that the patient's attending, which in this instance it's Burnley General Hospital. Name, etc. has already been pre-populated from the referral. There's now a section within demographics for other names. So you've got a section for a preferred name, alternative name, a maiden name and a bachelor name. So those are new fields that you can actually populate. Again, your demographics, your genders mandatory, date of birth is also mandatory. Again, these would have been pre-populated prior to the appointment. And again, we've got the UK residency status, which has to be completed and which is always checked by reception staff at every visit. We've got ethnicity, so again, you've got the option to select the correct ethnicity. And we've also got a patient needs field. We've got transport requirements, and as you can see, all these fields are shaded. Shaded isn't compulsory, but it is preferred that we do complete any shaded boxes. So we've got transport required, and again, this may be useful going forward to indicate whether a patient has arrived by transport. It could be that this information can be pulled into a report, and then that could be given to nursing staff, and then they know exactly which patients have arrived by transport. The next box is regarding advocate required. So again, is an advocate required to support the patient? Again, you've just got a yes, no, unknown. You've got interpreter requirements. Is an interpreter required? If they are, then yes, you just select the first language from the drop-down box. For this purpose, we'll just say no. And then with regards to digital correspondence, again, does the patient wish to receive digital correspondence? Normally this is yes, but sometimes there are patients that wish to just receive a standard letter as normal. But if they do state that they wish to receive digital correspondence, then they would receive their correspondence via the patient portal to the telephone or computer via healthcare communications. We've also got additional demographics such as marital status, again, all drop-down boxes, religion, which you can just enter, and then the religious affiliation. So for instance, for a Christian, you could just select Church of England, or you can actually start typing as well, and it will actually pull through the information. Home address is a mandatory field, and again, this would have been pre-populated, but you've also now got the facility to add a temporary address or a mailing address, which is definitely a useful facility for anybody that perhaps is staying with a relative, or they need their post going to a next of kin, or etc. Contact telephone numbers, as you'll see, if I take out that number, this is shaded, so it's not mandatory that we have a telephone number within the fields, because nowadays not everybody has a home telephone number. A lot of people just have mobile numbers. So I am going to just leave a telephone number blank just to show you what happens when I do try and save the information. We've now got the facility to enter work telephone number and extension, and also an email address. Again, we're not quite sure how we're going to use email address or when we'll use email addresses going forward, but that facility is there when it's required. There's also the preferred method of contact, and again, this is an advantage for people with special needs, etc. But again, we need to draw up SOPs and decide how we're going to use this functionality. There's also a preferred written format, and again, anybody with special needs may require large print letters, so you could actually just select large print letters, and that information will feed through to the printing company, or if it's required via the system. And we also have a preferred contact time, which is a field we haven't got now. But again, we need to look at how we're going to use that. You've got the facility to check the GP or update the GP by clicking on the magnifying glass. You can search you can search by starts with, so you can search with address that starts with, for instance, Whitton Medical Centre, and it would bring up all Whitton medical centres throughout the country, or if it just contains certain words. So we'll just try searching for a different organisation. So if I just put in Peel House and then search, it should bring up all practices relating to Peel House, which it has. So I'm just going to select Peel House at Accrington Pals, and then I have to select the relevant GP. So I'll just select Dr. Eccles. There is a section to add dental practice, and again, this would be done at the point of referral. And also we've got a comments field now for patient comments and historical patient comments. I'm not quite sure how we're going to use those comment fields at this moment in time. Then we have another tab at the top, which is relationships and schools. So again, you can see that you can now add relationships, i.e. next of kin, or you could add power of attorney, a guardian, etc. And you can just add all those details in. But I'll just cancel that out. This patient has actually got a next of kin recorded. Then you've got the option now to add school. As far as I'm aware, this trust has indicated that school must be recorded for all children of school age. So again, if you were to record the school, you just do a search on the organisation. So I'll just search for the Hollands. And it brings up the school. And then you've got you have to enter the beginning date. So I'll just enter the 2nd of May, and you can actually leave the end date free as well. And then that shows that this patient started at the Holland School from the 2nd of the 5th, 22. And then you can just save that information. As you can see, just go back. We go back to patient demographics, and I'll try and save again. You can see that it's actually saying that I have not specified any contact details, and it's asking me if the patient has a phone number. So basically, like I said, we do need to collect home telephone and mobile numbers where possible, and then we can communicate with the patient as necessary. So we can just update that by adding a phone number, then a mobile number. And then it will now allow me to save. So now, as you can see, all the patients have been checked in, apart from this first patient at 9:30. It could be that that patient has DNA'd, but in theory, the clinician, as part of the consultation, should be looking at the notes and then decided whether the patient is to be discharged or needs a further appointment, and they can do that within their section of the system. If a patient does, if you do check a patient in by mistake, you can uncheck the patient. So I'll just show you that. Let's just confirm this patient. Check them in. Just see everything's okay. Click on check-in, undo check-in, and it puts them back into a confirmed state. So basically, that is the role of the receptionist in relation to check-in. There are some other functionalities which reception staff will have to look at, and that's within my workflow. One of them is within the work item. So this is the section here. And what we've got a section called Catching Up Clinics. So this is really a catching up functionality. So reception staff may be required to look at this report to make sure that patients have been dealt with. So patients will appear on this report if the patients have been confirmed on the system, but they have not been checked in by the receptionist. So it's more than likely that those patients would be DNAs, but nothing's been recorded on the system. Or it could be that the patient has been checked in, but not checked out by the clinician, because it is the responsibility of the clinician to check the patient out. There's also other reports within the work item functionality, and again some of these will be dealt with by the booking centre, and I think these are on a separate demonstration, so I don't actually need to go into these. The top field here is all the requests that have come through. So these are the requests which the consultants have ordered as part of the clinical consultation. So they've actually requested further appointments. So this report shows that there's 68 patients waiting to be booked. And again, to book an appointment, you just literally go into the relevant patient and make an appointment. I can't actually do that because there's none of these actually set up correctly so that I can book a further appointment. And I've only got the facility to book dermatology at this moment in time. These are just test patients, different scenarios. And again, it could be that reception staff book appointments, anything up to 6 weeks, and then anything from there on would be dealt with via the booking centre. So in theory, this really is a waiting list report as well.
Thank you for watching, and I hope that you found this demonstration useful.